Mr. President, I rise in support of my colleagues who have come to the floor to urge the Senate to quickly pass funding for the Children's Health Insurance Program, also known as CHIP. CHIP provides comprehensive health insurance coverage to nearly 9 million low-income children who don't qualify for Medicaid, including in my home state of Delaware, 18,000 children. Lots of other states, 18,000 children would be a small number, but in Delaware, that's a significant population. But bluntly, whether it's 1 or 100 or 1,000 or 18,000, how can we allow inaction in this chamber to put at risk the health care of millions of children across our country? It's now been more than 3 weeks since funding for CHIP expired. And while some states have enough money in their accounts to carry them through the end of the year or just beyond, the uncertainty around if or when CHIP funds will be reauthorized is causing chaos, concern, and anxiety across the country. Some states will soon have to start issuing notices to households that they will face loss of CHIP coverage. Imagine the unnecessary fear this will bring to parents, to families, struggling households across the country as they are facing other challenges in their lives. Mr. President, this is totally unnecessary. We can stop this uncertainty right now and bring needed stability to parents, children, to states, and show some kind of leadership from this, our federal government. I'm a proud co-sponsor of the Bipartisan Kids Act. That's Senate Bill 1827 that's being led by Senator Orrin Hatch of Utah and Senator Ron Wyden of Oregon. And this Kids Act would extend funding for CHIP for 5 years. I urge the Senate to do right by America's children and America's working families and swiftly take up and pass this bill. Mr. President, while we're on the topic of programs desperately in need of reauthorization, I also want to draw attention to the expiration of the Community Health Center Fund, which ensures access to cost-effective primary and preventive care for 26 million patients across the country. Now, in my home state of Delaware, about 50,000 Delawareans benefit from several community health centers that are widely respected, well-run, and provide affordable, accessible preventive health care in communities up and down my state. Funding for this critical program also lapsed more than 3 weeks ago, and now, sadly, community health centers across my state and our whole country are struggling to make key decisions. Decisions like renewing leases or signing on new medical personnel and physicians. Without certainty that the federal government will reauthorize their funding, how can we expect community health centers to plan, to deliver on services, and to provide the preventive health care that reduces costs, improves health, and strengthens our communities? We should do everything we can to swiftly pass a 5-year reauthorization of funding for community health centers, such as the bipartisan bill that Senator Blunt of Missouri and Senator Stabenow of Michigan have introduced, the Community Health Investment Modernization and Excellence Act of 2017. That's S 1899. And I am proud to support that bipartisan bill. So, folks, I urge that we work together in a bipartisan way. We should not be using children and access to health care as a bargaining chip. We should be taking up these 2 bills and provide reauthorization and funding and certainty immediately for both CHCs and CHIP funding now and without hesitation. Mr. President, thank you. With that, I yield the floor.